Do you know that blood pressure is one of the most common reasons for which people visit medical centers or doctors? You may have also visited doctors for other reasons, but your blood pressure was also checked. You might have noticed two numbers when your blood pressure was checked. For example, 120/80. The first number is called systolic blood pressure and measures the pressure in your arteries when your heart beats. And the second number is called diastolic blood pressure and it measures pressure in your arteries when your heart rests between the beats. And both of these numbers are equally important in monitoring heart health. When we talk about blood pressure, we usually accuse salt. Salt is a primary source for sodium, and the overconsumption of sodium is associated with increased blood pressure, heart disease, and a stroke. Not only is sodium not always harmful, but it's an essential mineral which plays very important role in different functions of body. The body needs this substance to keep right amount of fluid in the blood, send signals through the nerves, and help cells work properly. On the other hand, excess sodium is linked to adverse outcomes such as increased blood pressure. The majority of sodium in our foods come from packaged food and restaurant foods. Even those foods that may not taste very salty, they also contain so much sodium. Foods with only moderate amount of sodium, such as bread, are the major source of sodium we take because we use them frequently. But how much sodium intake are we allowed to keep a healthy life? As I said, there is a lot of sodium in many foods that we use on daily basis, such as bread. But the solution is that to try to reduce sodium consumption as much as possible naturally. These are some recommendations to do it naturally. While we are cooking, we can use alternatives. For example, we can use garlic or citrus juice or other spices in order to make the food more delicious. Intake of fresh foods is also very important. For example, when we want to eat rice, meat, or beans, we should buy the most basic form of that, not the canned ones, for example, because for conserving these foods in cans, a lot of salt is added. So you can imagine that how salty they can be and they can threaten your health. Another recommendation is to eat more fruits and vegetables. And the last is that try to avoid sauces and ready-made pastas or flavored rice. They also contain so much salt. But what is the best mineral to control the hypertension? That is potassium. Your body needs potassium for almost everything it does. But how it works in hypertension? The mechanism of action is that the more potassium you eat, the more sodium you lose through your urine. Besides that, potassium relaxes your artery walls and it also helps to reduce blood pressure. There are also studies confirming the effect of potassium on lowering blood pressure. Analysis of 15 randomized controlled trials for potassium supplementation in around 900 normotensive and hypertensive patients independent of antihypertensive drugs had a reduction in systolic blood pressure by around 4 and in diastolic blood pressure values by 3.5 in all patients. But this effect was even stronger in hypertensive patients, reducing systolic blood pressure to 6.8 and diastolic blood pressure to 4.6. Our bodies need more potassium compared to sodium every day, but the typical US diet is just the opposite. But the good news is that you can find potassium in many foods, and the main source are fruits and vegetables and dairy foods. I give you broader source of potassium in order to give you more options while you are shopping. Dried fruits like raisins or apricots, beans, lentils, winter squash, potatoes, spinach, and broccoli, avocado, bananas, oranges, orange juice, coconut water, tomatoes, dairy and plant milks, for example, almond milks, chicken, and salmon. But sometimes people use potassium supplements in order to replace potassium in their bodies. But be careful about this. Before taking this medicine, notice if you have high levels of potassium in your blood, or you take a potassium-sparing diuretics such as spironolactone, amiloride, which sometimes are used to control blood pressure. Intake of high levels of potassium is not recommended for everyone. For example, for those who are suffering from kidney failure or acute or chronic kidney disease, because in that way, the kidney is not capable of removing the extra potassium from your blood, and then it would be accumulated and will have harmful effects. So before taking any supplements, first consult with your doctor. Sometimes the doses of this supplement should be modified based on the underlying diseases you have. Finally, thanks for watching this video. Hope it has been useful for you. Please like and comment if you have any suggestions or questions, and subscribe my channel for more videos.